Good morning. Thank you for being here. I'm going to share my results from my thesis project. My project is titled Evaluating the SNAP-Ed program in Pima County using geospatial analysis to improve reach and access to farmers market. So to start off with a little bit of an agenda, this is what I'll be covering in the next 15 minutes. We'll start with some background on the project, an introduction to the study area, the data sets that I use, the methods, analysis, results, and ending with the conclusion. And we'll finish off with 5 minutes for some questions. So for the background, what is SNAP-Ed? SNAP-Ed is a federally funded grant program that supports nutrition education and obesity prevention, interventions, and projects for SNAP-eligible people and locations. So it is funded by the USDA, and the USDA gives funds to states to then disperse to different local implementing agencies in the county and all the counties. So I work for the SNAP-Ed program in Pima County, and this project is geared specifically for that program. So these are this is what is the connection between GIS and public health. That's where I started this project. I have a background in public health, and I was really interested to see how we could integrate GIS technology into our program to improve our reach. So the way that I used it is for adjusting for social and economic deprivation, to describe the program, to document and increase reach to our target population, and explore any relationship between disease and environmental factors. The current approach to program planning for the SNAP-Ed program uses only census tract data to determine if a physical location qualifies for our services. And the two ways that we determine if they qualify is if greater than 50% of the population in a census tract lives below the 185% federal poverty level, or if it's a school site, if more than 50% of the students that attend the school qualify for the free and reduced lunch program. So I wanted to see, well, how can we look further? How can we dive deeper and look at different indicators to justify where we're doing the work? So the geographic problem that this project explores is how do we reach individuals in low income and low access census tracts, so beyond just looking at low income as I just described. And I also wanted to identify tracts that were high SNAP and low SNAP. So according to the literature, census tracts that are low SNAP is where 20% or less of the total population is on SNAP benefits, and high SNAP is greater than 20% of the total population on SNAP benefits. And the third problem was, what is the geographic distribution of farmers markets that accept SNAP relative where the SNAP where there's a high concentration of recipients? So there are many farmers markets in Pima County, but not all of them accept SNAP benefits. So this will only focus on the farmers markets that do, because those are sites that we work with. So back to the SNAP-Ed program. This is traditionally an obesity prevention program that just started with schools. In 2014, the US decided to teach people how to eat healthy and be active, but we need to improve the policies and systems and the environments in which people live to make it easier for them to make those healthy choices. So this project focuses on two of the focus areas of our program, which is food access and active living. So food access can look like limited access to healthy foods, also known as food deserts in a lot of the literature, and limited access to reliable and convenient transportation. Here is a map that shows the intersection of low-income census tracts and obesity rates for adults 18 to 64 years old in the city of Tucson. So at the beginning of this project, when I was gathering the data, I couldn't find any obesity data at the census tract level. It was only at the state and county level. I contacted the Arizona Department of Health Services, our state funder, to see if they had access to more detailed data, and they said no. And very late into the project, I attended a talk, and somebody used this data set from this Centers for Disease Control called 500 Cities, and I was able to get some obesity data at the census tract level. So this was a later development, but I wanted to start off with some background on it. So this is the initial problem of why our program even exists. And you can see this heat map. There are areas that yellow, darker, and red areas are higher concentrations of people that are obese and low income. I did extensive literature review on accessibility measures. So when we're talking about food access and access to active living opportunities, I wanted to see which measure should I use for this project. So I started off with a review, and I found that there are many different kinds, beginning with the service area, travel impedance, and gravity and potential measures. So here you see they are each are geared towards a specific purpose. I ended up going with the service area, which is the number of facilities contained within a given unit. I'll go into that further. So the objectives of this project. First was to assess the geographic distribution of farmers markets accepting SNAP benefits relative to where they live. The second objective was to estimate the number of neighborhoods within a mile of a farmers market. And the third was to identify farmers markets where future SNAP incentive. Now we're moving on to the study area. So here's a map of the study area, which is Pima County, because our program serves the entire Pima County. Total population is just over 1 million. I went further and identify the target population, which is the SNAP eligible population and those low income individuals. And according to the Arizona Department of Economics, approximately 67,000 households and 135,000 recipients are enrolled in SNAP benefits in Pima County, so quite a large number. So I'm going to take you through the process, the steps that I went through for this project. So started off with data collection, then I processed the data, cleaned it, and I built the network data set in order to run an analysis, and I created the maps. So these were the specifications for the data that I collected. I wanted it at the census tract level. And the reason for that was because of data availability. So my number one priority was to get SNAP data from the Arizona Department of Economic Security, and they had it at the zip code level and the census tract level. So then I went from there and I found the other health indicator data sets and food access that corresponded with that. So it still gave a pretty detailed level of what's happening on the neighborhood level. I know that census blocks are even more detailed, but it was actually a strength to be able to find this, as I said, the obesity data at the census tract level. And this was the projected coordinate system that I used. So here are all the different data sets that I used for this project, as this was probably one of the most intensive parts of the process. So that 500 cities local data for better health from the Centers for Disease Control, the Arizona Department of Economic Security, and that data is not publicly available, so I requested it specifically for this project. Pima County GIS Department, ESRI, a US Census, and the US American Community Service, and USDA SNAP data. So I wanted to break down a little bit more about what kind of census information I was looking for. So with the American Community Survey, or the ACS, I was only looking at the income, the 185th percentile of the federal poverty level, because that is what we currently use to target our program. And then I expanded on it by looking at the low income, low access tracks, which go into vehicle availability. So the question is, do you have access to a car? And food access. So that means for urban census tracts, which applies to this project, it asks if you live more than 1 mile from the nearest grocery store. So that is considered low food access. And as far as the age ranges for the American Community Survey data, I looked at under age 6 to 17, 18 to 64, and 65 plus, and broke it down by category. So more on the population demographics, this is what I focused on. I collected much more data than this, but I narrowed it down to the low income, low access, and the poor physical health, physical inactivity, and obesity from the CDC. Moving on to streets, since I did a network analysis for this project, I started off by collecting local data from Pima County, and I started to build a network data set. And a colleague of mine also pointed me to the ESRI North American Detailed Streets Layer Package, which is a massive data set, which I ended up working with. And then program data. So these were Excel files that I then converted to a CSV, and in order to manipulate it in ArcGIS. So I had all of our program data. So every single site that we work at, those are senior centers, farmers markets, schools, public housing, neighborhood centers, you name it, all geocoded, are set by site name with an address and latitude and longitude coordinates, and the SNAP recipients from the DES office. So that was 2016 data for the entire calendar year, broken down by total population, adults, and children. Moving on to the methods section. I used a variety of different ESRI packages, so ArcGIS Desktop and ArcGIS Online. I started off using ArcMap version 10.7, and I switched over to Pro. So yes, I learned how to use ArcGIS Pro for this project, and I actually like it much better. So I used the desktop versions for the network analysis extension, which is pretty limited in the ArcGIS Online. So data processing. After collecting the data, I cleaned it and prepared it. And as I said, most of it was in Excel format, exported it to a CSV in order to project it to ArcGIS. And to do this, I had to join on a common feature, which was the census tracts. So here I have a screenshot that shows how I did that. This was from when I did an analysis in ArcGIS Online. So that each layer, each data set did have the census tracts on it. So that's how I did the join. Building the network data set. This took a lot longer than anticipated, but I did experiment with different methods, as I said, starting off with a local data set and ultimately ending up with the Esri detailed streets. So first, to begin, what is a network? A network is a system of interconnected elements such as edges, lines, junctions, or points that represent possible routes from one location to another. So this transportation network includes streets, pedestrian paths, and it does not include railroad networks, but a lot of times it does. So this network data sets allow for travel on edges in both directions, and the agent on the network, for instance, a truck driver is traveling on roads, is generally free to decide the direction of transit as well as the destination. So you can get into some really complex and detailed transportation analysis. So due to difficulties building a multimodal network data set, I used an alternative approach using the Esri maintained detailed streets. So that feature layer had over 80,000 fields covering every street in North America, so in US and Canada. So the first step was to extract the local data of interest, and I selected attributes by state and then city, and I used the project tool to reproject the shapefile to the coordinate system. Here's a screenshot of the attribute table to give you an idea of what it looked like as soon as I exported the data that I needed for this project. I had to create 3 additional fields. So the attribute table, the first step was to examine it to see if it contained speed and length fields, which are required to run the network analysis. So they did not, and I had to add those fields. So the attribute table was missing the shape, length, and minutes, which was required. So there's the shape length field that was added and the minutes. And also the distance field was converted to miles. Here's just a graphic that shows a little bit more about what the network analyst extension is capable of. So service areas, itineraries or routes, fastest road, quickest trip, and distance time estimation. So this project focused just on the service area. So before diving into the difference between the buffer tool and the network analyst, I wanted to talk more about the workflow that I went through. So first I had to, in order to create a service area, I had to select the feature, which was polygons, and I had to create a facilities feature class, which was the farmers market's point data. After that, I selected the attributes of interest. So I did two different service area analysis. One was minutes and the other was distance. So those are both under the cost. And then the stored polygons were, I assigned them break values, so generating a 5-minute and a 10-minute service area for the farmers market facility. Those customized service areas are really great when working with data like the data that I had, and I determined those 5 and 10-minute thresholds based on prior studies and the literature review. And because we know, based on the literature and talking to people on the ground, that people that have limited access to transportation are transit dependent, which is a lot of the SNAP-Ed population, will travel up to 3 miles for food. So the 5 and 10-minute thresholds are also, that comes from the USDA's low income, low access methodology. So the difference in deciding if I was going to use the buffer tool or the service area, I weighed out the pros and cons. So just to start off with the buffer tool, the distance measured is the Euclidean distance. It's mostly applied when analyzing distances around features in a projected coordinate system. Some advantages of the buffer tool, which is part of the proximity tool set, is it's simple. It's good for two-dimensional maps in small areas. A limitation is that it's limited to straight line distances or as the crow flies. Service areas, on the other hand, with the network analyst tool, measure network distances, and this is done in time. It can also be done in time, or minutes, hours, and it's commonly used to calculate maximum distance time and area coverage along a road network. It's an advantage is it's very accurate in terms of human travel and how we don't fly over areas. And limitation is that it's very complex and requires you to build a network data set. So service areas also model the movement or people or things that move along networks. Buffers assume unimpeded movement in any direction. So counting the population using a straight line buffer would overstate the count of those who could reach the facility within, let's say, a 5-mile travel distance. One of the questions that I aimed to answer with the service area was what neighborhoods are within 1 mile or also known as walking distance to a farmer's market accepting SNAP. Here's a map that shows just a comparison of the buffer tool versus the service area. So you see the 1 mile buffer is that pink circle, and then you have a 1 mile service area. And as you can see, it generates a very different result. And then the service area also has, as I mentioned, you can specify different cost attributes and parameters. So here I have a 5-minute and a 10-minute cutoff for the drive time. And these are the farmers markets in Pima County that accept SNAP. This one down here in Green Valley is so far south that I just included it in this view, but we do have quite a spread of farmers markets that accept SNAP. When it came to programming the sites, I used both ArcGIS desktop and ArcGIS online. So one of the methods that I used for the analysis was a clustering method of youth and adult sites. So the adult sites were clustered into 3 groups according to the number of features per symbol. So the large circles indicate 3 features of adult sites in the area, with the smallest circles indicate 1 feature of per program site. And this is just a screenshot to give you an idea. It's not an actual final map.
Gabriela, you are running out of time.
Okay. All right. Can I cut the questions to 3 minutes and finish up?
Well, you actually has answered the 4 questions that I had in my notes. So I will have an additional question there.
Okay. Would you like me to just show the final slides or move on to questions?
Well, we can, I mean, if you can finish the presentation, of course.
Okay. I didn't understand what you were saying. Okay, so just real quick, this is the workflow for the service areas. So we started off with inputting the facilities, which was the farmer's market, creating a buffer, a 1 mile buffer. And then the second one there is starting with the network data set, creating a service layer, and ultimately a service area. And the bottom one was used to solve an additional service area. So this map is similar to the one I showed before, but this shows connections. So it shows shared use paths, protected bike lanes, and bike boulevards, future and existing, as well as the service areas and the walking distances. This was one of my main findings was I wanted, as I said I wanted to see what neighborhoods are within 1 mile of the farmers markets accepting SNAP. So I found that of 159 neighborhoods, 30 of them, or 19%, are within 1 mile of farmers markets. Back to income and walkability and bikeability to farmers markets. This is a map that shows a more detailed view of the 1 mile service area, which is walking distance around those sites, but with an additional layer of the low-income population, which is our target population. So I wanted to see if, in fact, the farmers markets that are accepting SNAP are in areas where low-income people live and easily accessible. And as you can see there by the darker colors, they are at least bordering some of those low-income areas, and in some instances, like the Santa Cruz market, they are located there. Others are not. So these really suburban ones, as Rincon Valley, Trail Dust Town, and definitely Green Valley. This is another map that shows the results with the names of the 30 neighborhoods that are located within walking distance. And you can see I used the color principles of cartography to when applying the service area. As far as census tracts with low car access, I found that out of 226, 165 do not have low car access, and 61 census tracts do. So this is really meaningful for our program. And here's a map showing those census tracts. And in terms of strengths of this project, I was able to pull data from a lot of different indicators and health data that was very difficult to find, and apply GIS to a program that is actually going to be able to use this project for the next competitive grant cycle in 2021. For future, I would like to do an exploratory regression model to see how the indicators are related and evaluate the combination of 4 factors and determine which are useful in predicting highest need by census tract. So future implications, as I said, the exploratory regression model to explore relationships in a more statistical manner. Would like to create a web map in ArcGIS Online for the program to use. So putting these maps onto a web map, and also doing a multimodal network analysis with transit stops. So here's that low access map again, this time with our adult sites. So this was a main finding. I wanted to see where our sites are located in terms of low income, low access, and they're color coded by youth and adults. In conclusion, this method was used to identify target areas of SNAP eligible populations. It also identifies opportunities to expand incentive programming to farmers markets that have high percentages of SNAP households within those service areas. And it will allow the program to model how to combine demographic data and network analysis.